There is this speculation that if you have regular intercourse, you won't have prostate cancer. Is that true? In this episode, we will know if your speculations are true. So let's get into it without wasting time. Prostate cancer is an abnormal growth of cell in the prostate gland. Though the exact cause of this cancer is unknown, but there are some linked factors that can cause this cancer, like the genetic factor. Genetic factor, if you have a father or an uncle or you have history of cancer in your family, you are at risk of having prostate cancer. Also, environmental factor like smoking, air pollution, unhealthy diet, you are also at risk. Occupation exposure like weather, firefighter, farmer, you are at risk. Old age, 50 years and above, you are also at risk because the more you age, the higher risk you are. If you have history of cancer in your family. Also, if you are an African descent, that if you are black, you are at risk of having prostate cancer. What are the signs and the symptoms of prostate cancer? Difficulty starting or stopping the flow of urine, frequent urination, painful urination, blood in semen or in urine, swollen leg like the edema, bone pain like the hip pain, the rib pain, or the waist pain. Also, frequent UTI if you are always having urinary tract infection. These are some signs and symptoms. Now, there are different types of prostate cancer. We have the adenocarcinoma. Adenocarcinoma is most common of the type of prostate cancer. Also, we have squamous cell carcinoma. Squamous cell carcinoma starts from the cell, it starts growing from the cell, then enter the prostate gland and occupy everywhere. We have neuroendocrine carcinoma. Neuroendocrine carcinoma grows very fast and aggressively. We have transitional cell carcinoma. Transitional cell carcinoma starts from the urethra, then goes straight up and occupies everywhere. It grows rapidly too. Now, the diagnosis of prostate cancer include digital rectal exam. This is when the doctor put on a glove to check your rectum for any growth or any abnormality. In this process, it will take a sample to run a biopsy to check for any growth of cancer. Genetic traits, by tracing back to check if you have any history of cancer in your family. Also, some image testing like the MIR test or the MIR scan or the CT scan. Also, they check the prostate specific antigen. This is by checking the amount of protein that your prostate gland produces. Any elevated level of protein can indicate or may indicate cancer cell. Now, treatment for prostate cancer include 1. Active surveillance. Active surveillance is by close monitoring of the PSA test to check and to track any growth of cancer. Surgery by completely removing the prostate gland from the body. Chemotherapy, these are specific drugs that kill the growth of cancer. Immunotherapy, by boosting the immune system to fight against cancer cell. Also, radiation therapy. Radiation therapy is by external beam light transferred to the body straight to the prostate gland to kill the growth of cancer in there. I hope you have learned something, and I also hope you now know who are at risk of having prostate cancer, not by not having frequent sex. So let me take you back. The risk factor are genetic factor, environmental factor, occupational exposure, old age, and African descent. Those are at risk of having prostate cancer. It's not by having frequent sex will reduce your risk. It's not it at all. If you find this video helpful and useful, please subscribe to my YouTube channel. I am Obadun Aderonke. I will see you in my next episode. Bye.